Hello, my name is Don Tatalovich. I'm the owner here at Cornerstone Dental Center. And today I want to just talk a little bit about guided implant surgery and what that means and how that might be different than maybe more traditional workflow. So with guided implant surgery, what we're talking about is using a guide. It's similar to a mouth guard where that guard or guide will be placed in somebody's mouth, usually supported by teeth, maybe supported by their gums, to help direct the implant placement to a very precise location in a patient's mouth. So with the implant placement process, I think one of the things we have to take a step back and consider is what are our goals? What are we trying to accomplish? And so ultimately we're trying to replace a tooth. When we use digital planning and the guide that's fabricated from that planning process, we start using what's called a crown down process where you're going to choose where that tooth or crown needs to go. And then you're going to, from there, determine based on the bone that's available and based on where that crown needs to go, where we're going to place our implant. And so this really allows us to kind of evaluate what our end goal, our end result, what we're trying to accomplish, and then base all of our steps on that. So with the surgical guide, we're using a digital process to evaluate where our predicted crown needs to be at, and then our implant placement will be based on that. Once we've decided that, our guide will help make the surgery more predictable and more efficient as we're able to place that implant very precisely where we're attempting to do that. We'll start off by talking with the patient and gathering information. And so for an implant placement and a guided surgery, what we need to do is we need to get x-rays of the bone in the patient's mouth. And then we also, as we see you, we'll take some pictures and take some scans of your mouth as well. And so we can combine all this information together and then start to actually digitally plan where we want that implant to go. And so as we do that, we'll be using, like I said, some x-rays, some scans, some photos, and then some digital software in order to create a surgical guide, which is what we'll use on the actual appointment day where we place our implant. So are there specific cases where we might consider guided surgery as being particularly beneficial? So there are actually a number of different applications where this could be really beneficial. For a situation where we're working in the front of someone's mouth and we describe it as a more aesthetic area or a more aesthetic zone in your mouth, having that implant placed really precisely so that the subsequent crown can be placed right where we want it at, that's going to improve our aesthetic outcomes. Situations where a patient might have more limited bone, being able to place that implant really precisely is going to offer us a really great advantage in that case as well. So with the process of digitally planning things, creating a surgical guide, and being able to precisely place our implant, we will generally see a pretty decided decrease in the amount of time that's needed to place that implant. And so this reduces, I think, patient anxiety as they're able to get through their procedure more efficiently, and this positively impacts healing time as the patient's not in a procedure as long. What's a common misconception that somebody might have about? All right. So as we've been discussing implants and guided surgery, what would be the next steps for somebody who's considering having a tooth replaced? So the next step really for that process would be to set up an appointment at our office. So please give us a call, and then we can start to gather some information about what your goals are and maybe what your needs are and what your treatment options could be. And then we can kind of set up a custom treatment plan for you and start to move forward from there.